And I'll now ask our second panel to please join us. So we'll start again with our I2 past recipients, and I will kick it off to Bill. Bill, would you provide your summary?
Sure. Good morning. Bill York, the acting president and CEO of 201 San Diego, at least for 11 more days. Mr. Ohanian will return. So 201 CIE is really a venture of a community information exchange. San Diego is unique. It has 1,200 agencies providing 6,000 services. And so having a client-centered record and a longitudinal record over time that is cross-agency with outcomes of whether the needle is being moved. CIE gave us cross-sector partnership to create an opportunity for a shared record. The American healthcare paradox is we spend a lot of money on healthcare. Other nations spend on social services, and that's what we need to be doing here in San Diego in the United States. And being able to measure those social determinants, measure what our community service providers are actually doing. Again, there are some challenges. What interventions do you take now that you know this person's touching 5 agencies in a week? It's helping agencies change their process, their intake, and helping to measure some of their outcomes. Are people successful? Alliance Healthcare believed in that.
Thank you, Bill. And I'll now turn it over to our next guest.
I'm the Chief Program Officer for Interfaith Community Services, one of the largest nonprofit multi-service agencies in North County. Our idea actually came from a simple and humble beginning from people that we were serving not being able to get into residential treatment or get into treatment services because they were not clean and sober. We wanted to provide detox services. We wanted to really live that Live Well San Diego model. Our original proposal was to work out a funding model where we worked with our federally qualified health centers to be able to embrace our clients and provide those supportive services that we're experts at. I think one of the biggest pieces is behavioral services and primary care. Integrated care is also about providing those social supports and being able to really make sure that no one falls through the crack. And that's something that we're in the process of building. And we've had some challenges. Some of our challenges are making sure that we can support that model long term. Interfaith is a pretty innovative and determined place. And we've been working really collaboratively to find some workarounds that still maintain the integrity of the program that we submitted to Alliance Healthcare Foundation.
Thank you very much. And with that, I'm actually going to just go in order and ask the trustees to speak to the 2 initiatives and whatever you might want to articulate for our audience.
Okay. Good morning. I'm Julie Howell. I'm a member of the program committee at Alliance Healthcare Foundation, relatively new member the last 2 years, invited by a longtime colleague, Dr. Joe Ramsdell, to my left. And I'm also the Senior Health Policy Advisor for the County of San Diego Health and Human Services. My privilege to work with Nick Mascione. I've brought to the program committee expertise across the health and human services. It's been my privilege within HHSA and Alliance to have worked particularly with 211 and CIE and see the innovation that it is bringing in the bidirectional communication with this very complex group of people who particularly need the social services. We're focused particularly on the homeless population and the homeless population that has serious mental illness as well as physical illness issues, and the innovation that's happening both within the county and through the partnership with 211 CIE is really advancing the field. Funding models are changing so dramatically. The Affordable Care Act and the expansion of the Medi-Cal population has been just a blessing for 800,000 people in San Diego who previously were not covered. But that's brought its own challenges in terms of financing. Now we're going to have an organized drug delivery system, long needed.
Thank you, Julie. Dr. Ramsdell.
Thanks, Julie. So I'm going to take a few minutes to talk to the people out there who are thinking about applying and use both the CIE and the Interfaith as examples of different things that I think the board went through in the decision. Our mission has always been to stimulate and nurture innovation And when we fund a project, it's not a typical giving a grant and wishing you well. So it's important to have a good concept when you bring your idea and recognize that, for better or for worse, I think everybody who is up here explaining how receiving the award has touched them will admit that you've kind of got a partner when you receive the initiative. For Interfaith, the idea was one that had been around for a while, the importance of social determinants, the benefits of integrated care in terms of addiction and other issues. Not a particularly unique idea. What was unique there was the management and the passion, much like Solution Farms and some others that you've heard from. Both of these programs affect people in different ways. CIE is a technical but also social systems program. So you don't really track it directly to a face. On the other hand, Interfaith, Solution Farms, and especially the squash courts, you can relate to an individual and a face. The last point I want to make, I promise, is timing. Because a lot of the reasons that some of the projects take longer than you think is they're either ahead of the game or we need to educate and develop allies going forward. So think about this when you make an application. The board will be thinking about that when we look at them.
Thank you. Don.
I think both of these examples represent entities that took advantage of their core competencies at the very heart. And essentially the innovation came layered on top of a very strong set of core competencies. So they stepped back from their mission their immediate mission, the one they would have told you this is what we do, and said, what are we actually good at? Now let's layer on the innovative idea, and then let's make the argument that our core competencies allow us the credibility to actually do that idea. And I think both of these organizations did exactly that.
Thank you. Jeffrey.
A couple of points I'd like to add. With regard to the 211 CIE combination or affiliation, I believe medical home is not a physician's office or a practice, it's where people live, and that's social services, that's how they live. And so I think the social information and being able to access that across platforms, I think is critically important, and so it's exciting to see that move forward. With regard to Interfaith, what sold me on the investment was that the team had already considered sustainability, so they had come to us with contracts with the jails and hospitals for overflow for detox. So you have to keep those things in mind as you develop your business idea, just as if it were your own business as it is, whether it be a for-profit or a nonprofit mission.
Thank you very much. We're going to go ahead and wrap up this panel.